Hi, welcome again to Myth Magic Medicine with me, Denise Villuma here, your host, and this is season 3, talking to immigrant doctors. And today, you don't just get 2 doctors talking, you get 3. Welcome to Emill and Joanna from the Dominican Republic, and Amelia, who's a full-blooded American. So, hi, thank you so much for doing this.
Thank you. We really appreciate you having us here. It's really a pleasure to be able to give our perspective and our journey. So thank you for inviting us.
Yes, we definitely feel honored being here. Thank you.
Joanna, because with the baby in arms, you may suddenly have to fly away. Why don't you start us off and tell me how did you decide to be a doctor? Did you have medical people in your family?
Actually, I did. My older sister, she's 9.5 years older than I am, and she is a doctor. She went into the psychiatry path, and I remember seeing her and all of her friends from medicine school gathering at the table at my house. They would be there every single day studying nonstop, and I just saw her, and I felt. I remember me playing with dolls as if I was in the operating room and things like that. I had this specific doll that I would go to the patio and just do some surgeries and things.
Yeah, it's good to start young.
Yeah. And I think I always liked science. My mom tells me the story that I had my own insect lab. And that was like with a glass magnifier and a pair of tweezers. That's all I had. I had like a notebook and a pen to write the characteristics of those insects that I would find. Obviously, they were gone by then because I was able to move them around and touch them and things. But yeah, that's how it all started.
Oh, good. So you went through. And you grew up in Santiago, and you went to school in Santiago too.
Yes, I was born and raised. Yes, I was born and raised in Santiago, Dominican Republic, and I stayed there since I was born until I had to come here.
Yes, I'm a believer in holistic education, and not everybody will know much about the Dominican Republic. Most people can place it as the other half of Haiti, but where is Santiago?
Santiago is on the north part of Dominican Republic.
It's not on the beach, though. It's not on the coastline. Exactly.
You can drive there. It's not on the beach, but it's very close by. Driving distance, maybe an hour and a half, something.
Yeah, it's the second biggest city of the Dominican Republic, actually. Yeah.
And it was actually the first capital of Dominican Republic. Then an earthquake happened, and they had to move.
I didn't know that.
When Santo Domingo comes into place.
Oh, I always assumed it was Santo Domingo because Santo Domingo's been around for a while. When did that happen? Do you remember?
Oh, no,
I mean, not living memory.
Get back to you.
Obviously not in living memory, but
yeah.
So
we weren't around back then.
So you decided that you were focused in through high school, this standard system. Does it follow pretty much the American system, 12 grades and you finish it? Yeah. And so you applied to university. Why did you choose the university that you did?
My sisters went there, and that was the best in the area. We were able to get credit for me, so I could go to school. And how do you say credit? Like a tuition? Is that how you call it?
No, you mean you could get a stipend? You got some sort of assistance towards your
financial
tuition?
assistance? Yes. Yeah. We call it credit, so that I'm translating.
Sure. Yeah, I know.
Yeah.
It took me the longest time. It's like, spoiler alert, I went to medical school in Dominican Republic too. It took me about a year after leaving to stop saying asistencia or horario. I didn't translate, I just used those words. Anyway, asistencia being attendance and horario being schedule, for those who don't speak Spanish. So you chose to go to school. Did you give yourself a break between high school and starting college?
No, we regularly don't do that. Or back then, I don't know how it is right now, but back then, when you finished high school and you went straight to your university.
Okay, so you started in September, October.
We started
graduation
I think in August. You graduate in like June, and then in August you start.
Oh. It's so hot to start in August there. Anyway, okay. So the standard training, anatomy, physiology, biochemistry, pathophysiology, all those things.
This is the big difference between the Dominican Republic and maybe some of the country that actually we don't have to do that undergraduate.
Correct.
Actually, when you apply, you go directly to med school. And in the med school curriculum, it is included all the basic science, and it's kind of in all the time that you have to, you're going straight to med school, and you actually do all the basic science with the same team who is going to be actually kind of transition to med school, finish with you all the way from med school. So it's kind of different. And that's why we don't have an undergrad. We just have kind of doctor of medicine degree directly.
Right.
And I know
it's actually say true for many, many countries. It's really a North American thing, not completely, but the UK, you enter straight through, you call it reading medicine, you go directly into the medical program, but all of the basic sciences. Now, did you have prerequisites in high school in order to matriculate? Did you need to have a certain number of credits in physics and chemistry, etc., prior to going to school?
No, not to go into school, but during the school years, obviously you had to accomplish a certain amount of credits in order for you to pass over to the next chapter.
Sure.
Yeah.
The curriculum in high school is pretty standard. It's not that you can select what you want, what you don't want. Actually, that's dictated by the government, which actually like things you have to do. You cannot change that.
So there's a national curriculum.
Yes, it's a national curriculum that everybody have to go through it. I cannot choose what I want, what I don't want. You don't have like a path that you can go like more like science or doing more technology. No, actually there is only a specific school that can be, but that's very, very few. Actually, most of them is kind of is standardized, and in order to apply for med school, you only have to have really good grades in high school, and that's what they take into consideration to see if you will be able to join med school there.
And then pass a test that they give, and if you pass the test, you get into that specific school that you want to go into.
Right. So Okamaima had its own exam. Okay.
Yes, it's from the Asian University actually have their own.
I apologize. I can't get the P in there. I learned it as Okamaima. It's not getting the P. That's not happening. So you went through 5, or what point did you start seeing patients?
Started seeing patients, I would say by year alone, or just started seeing patients?
Starting clinical work. Yeah.
Clinical, I say year 3 or 2. Because you start with rounding through the hospital with the residents, and then your attendings. You don't conduct direct patient care. You start conducting direct patient care in the last year, and that you can take care of those patients on your own. But in the beginning, it's more like laboratories that you get to go to the hospitals, the public hospitals there, and start, seeing how the system works, and studying certain subjects with the patients. Like, for an example, how do you say semiology? Semiology? I don't know. It's the starters of how to interview the patient. So they will give you a guidance on how to interview these patients, like the SOAPs, like subjective, objective assessment plans and things like that, the HPIs, and then the HNPs, and then you would go ahead and interview those patients and then present to your attendants.
Is there a specific hospital attached to the university that you did those rotations, or were you in different places around the country?
There are different hospitals, but they are all associated with the university, the med school. So we did in different areas due to the fact that not all hospitals would take care of the same type of patients. For an example, we did a pediatric rotation. It is specifically at a pediatric hospital. We did adult rotation specifically at a different hospital. And then more focused subjects like endocrinology, then you would have to go to a different hospital as well.
But I do want to clarify that question. Actually, they're public, like government hospital. It's not that university have the money to have their own actually hospital. No, they have association agreement between the public hospital, so we can go there as a medical student to go and rotate with attending there.
Okay. Was there anything when you first started seeing patients that surprised you? Yes, everything surprises us when we see people, but I'm trying to think, because you presumably came from a fairly well-educated community. This is a country that is still having some issues with development, because you can be really, really, really rural there and see a doctor once in your life. What surprised you? What did you find you were able to do? What deficits annoyed you because you weren't able to provide them for patients? Were there things that were frustrating for you just as a student, because the differences in income levels and what was available for whom?
Yeah, I remember one time, and this was extremely frustrating for me. There was a patient of mine that needed a surgery to undergo some type of surgical procedure. And the day of the surgery, the patient was in the table and everything, but there was no anesthesia. So
no anesthesiologist, or no actual medication?
The medication.
Mm-hmm.
The medication. And I remember me and some other group of friends, my colleagues, we started just raising money to buy it because we couldn't find it anywhere. In the hospital, there was no anesthesia in the hospital for that specific patient, for the type of anesthesia that that patient needed. So I guess I can't quite remember what happened exactly, but that was something that struck me a lot.
Yeah, for my side was a lot of things. It's just kind of, for example, like a high-end imaging. The little things we were not having the luxury of, even at that time, having a CAT scan and MRI. So I think because of that lacking, make us like a better clinician, in the sense that you have to go and get a better history to what the resources that you have, try to make a better diagnosis. And that's why kind of in my country, we always say you have to do a good H&P that will give you 90% of the diagnosis, just because the necessity of not having all those imaging, all those fancy tests. And at the end, you have to really treat your patient, give the best care that you have. So that's why a very detailed physical exam and very good history, that was leading to our management, the treatment that we were giving to our patients.
So you managed to get through all of the studying that most of the people listen to this are doctors, but not only. So you managed to get through, you got through finals. And what was your next step? Had you decided that you were going to come to the US to study?
Yes, I definitely know about that.
Was that because a family member had come before, or just you watch movies?
Yes.
No, okay.
Yeah, so my family from my mom's side all lived in the States, and my sister who did the medicine and psychiatry, she was already here. So we knew that we wanted it to expand into different areas, and the USA was the next step for all of us. And I have a middle sister, and she also was here by that time. She's not a doctor, she's an engineer. But she was also here, and I wanted it to be close to my sisters too. So I always knew that my next step would be USA.
So you went to New York?
I went to New York, and but before I went to New York and started residency, I studied for the USMLEs, step 1, 2, and 3. And I stayed in Dominican Republic at my mom and dad's house. I lived there. I continued living there until I passed all of my exams. And
so you finished with the Dominican side of education, and then you took you didn't take the part 1 during your studies?
During my studies,
that's so hard, because you're going to go back and remember all that stuff.
Oh, it was great. I loved it. It was hard, but I felt much more in love with medicine. I just loved the process.
Yeah, for me, it was definitely different. My father is a dermatologist, so I always knew that I was going to do medicine. That's the example. I just remember being with my father, going to the rural area of the Dominican Republic, doing free services to the underserved population. So I knew since the beginning I went directly to med school. But at the beginning, actually, I was thinking to going to do my residency in Spain. just because
Mhm.
my first language it is Spanish. I didn't know anything about English, so all my med school was in Spanish. Everything I was directly going to my plan was to going to Spain because I have a brother who lives there. But that's when the crisis in 2010 that Europe and Spain
Mhm.
was kind of really bad. So I have to take kind of the decision to see, okay, it's not the best option at this time. So I guess United States is the way. So I started studying English and the USMLE at the same time. And it was a very challenge to do both. And
Yeah, a big
basically,
challenge.
yeah, it's a big challenge, like learning a language, plus also studying for the USMLE, well, with a clear path of what I want to. So basically, I have to restart all over because even guidelines are different, things are different. So I studied medicine again in that year that I studied for the USMLE plus English to be able to go up to speed. Even I remember
Yeah.
my friends when
Even more fun because our system is based on Grey's Anatomy and is it Rousseau? I can't remember the name of the book, but on that book, we all burned them at the end of the session. But so you both just happened to wind up in New York because your journeys were separate and different parts of the island but you both arrived here by some miracle of study and determination and God's will. You wound up in New York City. Where did you get residency?
In Lincoln Hospital in the Bronx, New York.
Mhm.
So
And what
it
struck
was
you as
magic. Like the first day we were sitting next to the other during orientation. Like both from Dominican Republic. I mean, she's from the north side, I'm from the south part. So we were kind of, hey, hi. Well, we are here. Let's start this journey together at this time, and then just go into the residency and the magic start.
That's great. And you have three beautiful all daughters, three beautiful
Also,
daughters.
yeah.
Yes, ma'am.
Probably by the time this airs, this young lady will be, double her age of only 2 months. So let's go back just a bit. You worked, did you do and you didn't do what they call pasantía, you didn't do the essential internship for licensure, and that was because you knew that you were going to come to the US.
No, I did, but only 3 months, because by the time that I received the pasantía, that internship after graduation there, it was already too late. I think it was March of the same year that I started residency.
Okay.
So I was only able to do it for like 3 months, but he did it his full year.
So I just want to clarify for the people, the pasantía is like a mandatory, like rural, like year that you have to serve the country basically. And that comes back when we only have one med school that actually was kind of free. So the way that they able to kind of not get that money back, but at least serve the undeserved area. So they create this mandatory 1 year that you have to go to those rural area to have physician there. Even if that is just recent graduates, so they can have those physicians be there. And for 1 year, you learn a lot and experience a lot in those.
Also point out, since you've mentioned the university, I won't butcher the pronunciation of the name of the National University. You can say it, and then what people call it.
WASP.
The WASP, yeah, the WASP. The University
de Santo Domingo.
Yeah, that was founded a long time ago, before we really had medical schools. So I think that's also a surprise to people. After all, there's some competition between Salvador and the Dominican Republic, but it is believed by most people that Columbus wound up there first, and it's been a long road. But the first cathedral in the New World, and the first university in the New World. So I didn't realize it came because of payback, essentially. For the WASP, and then they just required it for all medical students. They just require
it because at the end they just realized this is a good way to have physicians there, so they kept that. And if you don't do that year, you basically are not able to actually get your full license to practice medicine that we call the exequatur, basically the license number you will not be able to get if you don't do that. I did finish that just before actually coming here, because I was studying there. I was kind of working, and at the same time studying
So
for the
you were doing pasantía whilst you
Yes, I
were
was
working
doing
on, while
pasantía.
you were working on the USMLE and learning English.
Exactly.
Okay. What do you do with yourself now? That must have been crazy.
That
Okay.
prepared me significantly. I mean, it's a lot of challenge, definitely, but I think that opening, and we were discussing off camera that it's just that thirsty that we do have, that desire to accomplish a goal. Definitely, I would kind of focus, even though it was extended hour. I have the vision what I wanted to do, so I just kind of went directly for it. So at the end now, yes, I was sacrificed. I remember friends of mine telling, let's go to the beach this weekend. So I know I have to take my exam. And when is your exam? In 6 months?
6 months,
And you
yeah.
can and you cannot go this weekend.
Yeah.
So
Welcome to medical school.
yeah.
So both of you got to Lincoln. For those people who are not familiar with New York hospitals, would you like to talk a little bit about Lincoln?
Oh
You
yeah,
have
definitely.
fond memories?
Fun. Definitely. I think this is the kind of hospital that definitely prepare yourself significantly. There is good, and I definitely respect a lot of like Bacon University Hospital. There is a lot of education, a lot of syndrome that you will definitely see in advanced medicine that yes, it's necessary. You need to definitely refer to those big centers that they will be able to investigate, and definitely it's necessary. But for the real medicine practice and do everything really yourself and having the volume, actually is New York. We saw everything possible. I mean, our program was huge, and also was a good actually group. So actually we enjoy significant, even though it was a lot of work, but we really enjoyed.
There's a certain amount of we're all in this together when you're residents, right? Yeah.
And I think our group was really good. We're very passionate, and the teaching and all the attending that we did have very realistic and definitely to the point. I mean, we learned a lot, and that made me feel really comfortable. Even after finished residency, I was competent. Even we have this program like a junior attending at the end, that we were basically running the show. Of course, at the end, the attending used to kind of double check things, but they felt so comfortable. We were kind of running the full show, and that's part of the public system in New York. They also help us, and we help actually to help the patient, but at the end give you that confidence that when I was out of residency, the transition was like nothing. I didn't feel uncomfortable at all. So it was a challenge, a lot of things, and also for me, at least, was really good in the sense that the Bronx is a lot of big Dominican community, so that actually made my transition a little bit better.
Is it bigger than Washington Heights?
It's almost now is the point of Washington High now is becoming a little bit more fancy, and they're trying
I
to
know, yeah.
push a little bit and
Gentrifying and
increase the
goodbye
rent.
Dominican.
So they are actually moving to the Bronx,
They
most of the
better
Dominicans, because
don't
it's
get rid
cheaper.
of Malecon. I like Malecon.
Yeah. So yes, it's a huge community. Almost, I think it's almost now it is almost the same in both sides. A lot of the Dominican, I think it's almost 3 million of Dominican in New York. So and they used to go to Lincoln. So that actually, for me personally, make me feel like sometimes I used to talk in Spanish. Most of the time I was talking in Spanish with my patient. I knew what they mean, all those terms that only Dominican will know, and able to help my community. And they always want to tell them, I want to talk to a Dominican doctor, and things like that make you really proud. So that was really something rewarding, and make that transition that for me from having everything, and to be honest, I have a really good condition in Dominican Republic. With my father being a physician, I have everything now. Coming to a different country when you're by yourself, then you're out of your culture.
So, unlike Joanna, you came, other than her, you didn't have family here.
No, I didn't have any family. For me, it was kind of full adventure, just kind of by myself, and just having my goals. So I think actually the best thing that happened, I have a lot of interview and definitely match there. So I think God want me definitely to
There was a
go
plan.
there. Yeah, it was planned to be there and to meet her.
Yeah. So your internal medicine, yes. Okay. Hospitalists are a new breed for me. They weren't, they were coming in as I was phasing out of medicine. So did you decide on hospitalists because you'd have a little more control over your schedule, or was there something about it that just really appealed to you?
So two things. First, I like the acute setting in the sense that I like the hospital. I like to make sure to do an impact when they are sick, and when they are better, bye-bye. I don't like to follow up. I don't like the simple follow-up. So I like this.
But then you don't get to prevent them coming back.
It's
that's
okay. The
nice
primary
thing.
care can do a good job there. It's just not doesn't go to my personality. I like to be walking. I like to be there. I like to be moving. I don't like to be sitting down like in a chair.
That's I
That's kind of
understand. I was ER for the same reason. That's
yeah.
okay.
So that's why. And also at that time, I really wanted to kind of continue growing in the administrative part of the healthcare system. So that's why I went to the hospitalist. I decided to pursue like a board certification, healthcare quality and management. Yeah, that's why also I at some point I became the medical director for the hospitalist and also the chief of medicine for the hospital.
Once you finish your residencies, did you come straight away to Florida, or did you stay in New York for a while? No, you moved out
Directly.
You missed the sun, or okay.
That's exactly. I remember my first winter. I didn't have any car, waiting for the bus in New York. Like, what I'm doing here?
I remember Francisco calling me and say, "It's snowing," and I looked outside and there were like 3 flakes. It was it was so excited.
Well, I have a very tight relationship with New York, so I could still be there, but he doesn't like it that much. But for me, it would be more like upstate New York, not the New York City area.
Yeah, when people say New York, they mean the city.
Yeah,
it's lovely, but it's like 2 separate things. The city, and it's bigger than a lot of countries, so the place is massive. So did you notice any differences now when you emigrated from New York to Florida, which is, further than you immigrated from the Dominican Republic to Florida? Do you miss anything from New York?
So I think for me, the big difference is like coming to private practice is a little bit different than the public system. A lot of practice things that we do, even the relationship with the consultants and things that we do and the care, and also having more insurance, more ability to do even more tests with no restriction. Definitely that help here in the private practice. Also
age of the patients
like
as well.
Here in Florida, we work a lot of retire.
Do you find that you're still having to practice legal medicine? I mean, I obviously you practice medicine legally, but do you find, I know the answer to this, I don't need the lab to make this diagnosis. Do you find you still have to do the tests to prove it to people?
Because of my training, sometimes, yes, I agree with you. It's like I don't need it, but you have to most of the time to really
check the box,
document and definitely just confirm something. Because at the end, when there is a kind of chart review or something retrospective, like this is not done, why?
I know.
But of course, within the standard.
But I was right anyway. Yeah.
Within the standard of care, not I don't practice just in case MRI of the complete body. No. It's not. In the clinical practice, the clinical context, yes. I mean, I have to do. Yes, I have to. I will order if necessary.
Okay. So let's go to some cultural stuff. What do you really? I've been dying to ask. I asked Emil when we first met online. I had all my kids here. And I did not grow up in the Dominican Republic, but we have relatives obviously there because my husband's from there. So we go there and everybody's got a nanny and everybody's got maids, and I go in to make a cup of coffee and they won't let me. And but I could really see how that would have been so helpful when I had my first child in my 2nd year of residency. So what things do you really miss from home?
I think from my standpoint, I didn't really have that growing up, like we did everything ourselves, that I mostly miss the community, like feeling that you belong to a place and or somewhere, and that your family is close by, and it's like, okay, mom, I'm gonna go out, can you take care of the baby, please? We don't have that here. We would have to wait like months before somebody can come and help us out. So yeah, I think the family unity is the one thing that I miss the most. How about you, Emill?
Yeah, in my case, yes, we did have a full-time person at home, like a house manager. I mean, she was awesome. She used to cook amazing. I mean, she's still at home. She's still cooking amazing every time I go there. She knows almost things that I really wanted. But also that Joanna said, like the family, and also even with the friends, that here everything you need to do a big plan. And everything there. I used to just call, everybody was available that night. Let's go to this place, let's get together. So you don't need really a full plan. Everybody's always open to. And also the life is not like as fast as here. People can really breathe a little bit. People enjoy life a little bit more. It's not like, yes, you finish work and you have to be your phone or responding email, things like that. No, people really disconnect themselves.
Some of that's fun, but when it comes to administrative things, if you're not used to that, it can drive you crazy. When you go, for example, to deal with your cell phone and you have to stand around for an hour before you see somebody, it can make you a little nuts. Doesn't bother all the Dominicans because they're used to it. But those of us who are not find it hard. I think my husband would have a hard time living there again. Living there, visiting, fine. But I think living there, those things would probably get to him. When I was in med school, I remember he just got in line to get in line. That was but the other side of that is that it is so much more relaxed. A meal is an event. You sit and you talk and and nobody's shooing you out of the restaurant or the house.
Yeah, that's kind of the main thing, and people are really happy, people dancing, all these kind of things. I think that's the warmth feeling. This is maybe that I may feel.
Yeah, that friendliness. You get to a place, everybody's hugging each other. Even if you don't know that person, you still hug them. That was actually one thing that was very difficult for us to try to stop doing here, especially with the Asian population. I mean, they would freeze like a piece of ice, and I would be so ashamed that I'm so sorry. It's just, it's my culture. We do this.
I'm English, and I came to the States and was surprised at how huggy Americans were, and Canada too. I lived in Canada for a while. But when I went to the Dominican Republic, I kind of had to get over it. but it is, it's like, you're assaulting me. Why are you assaulting me? But when I was in training at St. Luke's Roosevelt in Manhattan, where we had a very large Hispanic population, not just Dominican, a lot of Puerto Ricans, a lot of Salvadorans. Back then, there was a big crisis of immigration because of refugees. And they would bring me food in, or they would bring chicle. And yes, when I had a baby, presents, and I was doctora, but I was Doctora Denise. I didn't use my last name. It was just a different relationship. Sometimes a little alarming. I don't know if they do it still, but the children would come in like frilly dresses, very, very like they were going to a Sunday party or a quinceañera or something. But it was in honor of going to the doctor. It was a sort of a sign of respect for going to the doctor, little patent shoes. And
yeah, that's what kind of really respect, even to travel in an airplane. I mean, to go into church and everything, you have to be really well dressed. I mean, this is something that, yes, you cannot have the luxury. You have to be impeccable before like going to those places. Yeah.
And then they hug you and give you a keeping.
Of course.
Okay. What else would you like to say? Because you've been chatting for an hour now, which is lovely of you. Thank you so much. And I'm going to trim it down. But is there anything else you'd like to say? Do you think you'll remain in the US? Do you think you'll go back? Will you be like many Dominicans and retire down there in the winter?
So
well, you won't need to. You're in Florida.
No, for us, I mean, at this time, at the end, like the university and the education for our kids, I think better here. We know that that for sure, that at the end of what they decide, we're going to definitely support. We are here, and one of the decisions we are doing, actually, we're moving to Dallas to be close to my wife's sister, because we want to give our daughters that sense of
Family.
family, community. Actually, we can buy the house next to her sister, so they have also kids and everything. That's what we want to make sure that they know that.
Yeah.
Also, we have our thing that within these four walls of my house, we only speak Spanish. So they are really well in Spanish and English. Besides being 4 and 2 years old, they actually speak both of them. Outside speaking English because of course they need to know
Right.
on that part, but also inside the house it's only Spanish. So I want them to actually keep the culture, knowing and being there. My parents are still there, and her parents also. We actually go very often, and our kind of dream is to see, and we're trying to do how we can spend the summer in the Dominican Republic, so they can be exposed to the culture, exposed there, and having maybe like a summer camp over there. So that's kind of how we thinking in ourselves. And at the end also is how we can help, how we can impact there. So our 5 to 10 year goal is actually to help create a assisted living facility for free in the Dominican Republic with elderly patient with dementia. My father in the last 2 years has been going down with dementia. So has been a big shock that the lack of opportunity for people, unless you do have a lot of money and good service. So it's very difficult if you don't have that. So that make an impact for me. So now that's kind of, we are working to see how we can help and to do that, to implement and just give something back that for me is really important and part of my why.
Wonderful. Thank you so much. Thank you again for joining me. It's been lovely. You have to come back and talk to me about something else in another season. Thank you. Bye-bye.
I would love to. Thank you.
Thank you for this invitation.
Thank you for joining us at Myth Magic Medicine. If you have found this episode useful, you can apply for free CME credit through the link provided in the transcript. If you're not a medical professional, please remember, while we're physicians, we're not your physicians. So please consult with your own healthcare professional if you think something you have heard might apply to you or a loved one. Until next time, bye-bye.